begin with new details on the growing measles outbreak in southwestern Ontario. Nearly 50 cases now across 2 health districts, and public health officials are joining forces today to sound the alarm about the spread. As CTV's Krista Sharpe tells us, there are also some new moves to encourage more people to get a measles shot.
Cases of the measles in southern Ontario were on the rise, with Grand Erie and Southwestern Public Health reporting a collective known 49 cases as of Tuesday morning.
There are cases out there that we don't know of because some of the cases that get reported to us are anecdotal from other community members that say, I know of a couple of cases in the community which haven't been reported to us.
Grand Erie Public Health says as of January 1st, they've had 37 confirmed cases, 5 in adults and 32 in children, with at least 1 being under the age of 1. Meanwhile, Southwestern Public Health is reporting 12 cases with 1 adult and 11 children impacted. In a joint press conference, the top doctors for both regions announced that because of the outbreaks, NACI, the National Advisory Committee on Immunization, has lowered the eligibility age for a first dose of the measles vaccine from 12 months old to 6.
We're encouraging our local parents to talk to their healthcare provider about getting a first dose of measles-containing vaccine between the ages of 6 and 11 months.
Typically, early first doses are recommended for children who are traveling to at-risk areas, which Dr. Tran says Grand Erie and Southwestern regions now are.
The reason why Canada and Ontario has traditionally had your first dose at 1 year and your second dose after that is because having 2 doses starting at the age of 1 year provides much better lifelong protection.
Case counts show some specific communities have been hit harder than others, with a number of churches and religious schools listed as exposure sites by the health units. Dr. Locke says Haldimand Norfolk is an underserviced area for vaccinations.
There are communities down there which don't really vaccinate their children as well as we would like.
Both health units say they have increased education in schools and are providing in-school vaccination clinics for those who are willing.
These community members do not have computers necessarily or access to normal media communication. So we've been sending out as much as we can letters to go home in their backpacks.
Adding that 2 doses of the measles vaccine gives about 99% protection and that the general public, if vaccinated, are not at risk. Krista Sharpe, CTV News, Kitchener.